So this is my ID presentation. We chose the healthcare scenario. This is for Dr. LaPrairie's class, ISDT 7350. My name is Eric Wilburn. Going into the scenario and question number one. So a hospital hired me. An audit was initiated originally to randomly select selected a sample of patient charts for the past year. The review identified sources of error, including insufficient documentation of patient records. A high percentage of entries were judged illegible. In 10% of the cases, duplicate medical tests were performed. The current CD-ROM program on chart management and maintenance that was purchased and made available to the staff did not work. Had lots of glitches, lots of problems, missing information, breaching information, overlapping information. So my mission statement would be to develop an instructional product and custom training program that's effective for the healthcare staff to accurately account for and maintain and defend patient information, including their medication trail, lab diagnostic, x-ray results, and other test performances in their chart. This training program will require reduced training. What design considerations must be taken into account when addressing the identified need? Number one, make the instructional product designed so that it in turn reduces clinical training time. Number two, make the instructional product cost effective. Number three, the instructional product needs to comply with standards. For example, the HIPAA standard. And immediately I would address the hospital director and inform him that the current instructional product with the CD-ROM is a violation of HIPAA standards. And HIPAA standards, if there's any kind of breach of patient confidentiality, overlap, or misinformation, he is to contact his risk manager and medical malpractice insurance carrier immediately. This is clearly a violation of HIPAA federal law. Also, any kind of devices that were used, laptops, phones, anything that had patient information on it, cannot be, they must be encrypted and cannot be shared to breach patient confidentiality or misconstrue information. So also an entity has to be appointed to protect the information. Have to have what's called a business associate agreement. And this entity has to be able to ensure that the patient information is not turned and twisted, breached, overlapped, mistaken for, etc. Also, all the employees on this new instructional product have to be trained on HIPAA requirements. The initial and subsequent training sessions have to be documented, and all the employees must sign confidentiality agreements. So the risk analysis, the review of the product, this all has to be updated periodically. A thorough risk analysis of potential risk and vulnerabilities to the confidentiality, integrity, and ability of the product have to be ensured and documented. Question number 3 asks, what questions would I ask to assist myself in determining societal and learner cultural factors? Number one, what instruction should the healthcare worker receive based on their culture and learning skills? Number two, what can result by not providing culturally safe services? What societal determinants exist? Who will be the users of the instructional product? Number three, cultural awareness and cultural competency are required for cultural safety. Very important. You got to know who's using the product. It's just so important. You have people from different backgrounds, and so ethnicities, societies, and there's just so much involved. And some of the things to consider are like I said, there are a number of social determinants of health. Social determinants of health. These are some are modifiable while others are not, such as genetic makeup, gender, and age. All healthcare workers should receive education on the specific needs of their patients based on their culture, and should understand that in a multicultural society, approaches to health delivery can vary when dealing with patients of different cultures. In order for healthcare services to be effective, they need to be both appropriate and acceptable, and should be delivered by competent healthcare workers. So training for delivering culturally safe healthcare, it should include theoretical and practical components. If you don't gear your instructional product to provide culturally safe services, it could result in bad outcomes. So what are the contextual and design-related constraints that may present themselves on the process? Some of the most significant factors affecting performance, development of instruction, and the application of educational technology in healthcare are knowledge and research, costs and managed care, regulations and standards. I've already mentioned HIPAA, and convergence. I want to talk about convergence. The boundaries of convergence can be very important, and so they're very influential. Technology is always changing. Informational applications are becoming increasingly ambiguous, especially in problem-based learning and evidence-based medicine, where the convergence extends into practice, where electronic medical records can be coupled with other systems. So lots of convergence in the industry, the healthcare industry, but the number one constraint is going to be budget, cost. That's number one. As a designer, how would I attempt to prevent or overcome the constraints that I have identified in the scenario? So we're going to reduce the cost. We're going to reduce the clinical training time. We would identify all applicable regulations and standards and stay in compliant with them. And again, for example, HIPAA. And we would identify the convergence. What type of instructional design development process model would be most applicable for the scenario? So this development team used the ADDIE model to analyze, design, develop, implement, and evaluate. To manage the instructional product and training process, the process included user profiling, the formulation of teaching and learning objectives, constructing a blueprint for targeted instructional assignments, designing an aesthetically sound interface, effective interaction design, production of learning activities using various multimedia development tools and appropriate programming languages. So trying to address everyone's, conform to everyone's needs and abilities. Question number 7, which technology integration model would I select to guide instructional design in the scenario? And the answer would be the best known of these is the Technology Acceptance Model, or TAM, which was presented in 1989 and has been applied and empirically tested in a wide spectrum of ICT application areas. The TAM is one of the most popular research models to predict use, a person's intent to perform a particular behavior, and acceptance of information systems and technology by individual users. Thanks for listening. This is my ID presentation for the healthcare scenario.